Okay, we are going to move into talking about non-addictive alternatives to dealing with problems with pain and anxiety, and also strategies for avoiding an external referral for fitness for duty evaluation. Okay, non-addictive alternatives to for pain control usually involve multiple different medications, and most of them actually with pretty mild side effects. The non-steroidal anti-inflammatory drugs, or NSAIDs, Motrin or ibuprofen or Aleve, generic name naproxen, are commonly used as non-steroidal anti-inflammatories for relief of pain. Tylenol also relieves pain, but it doesn't have an anti-inflammatory effect. All of them have some degree of effect on fever and will reduce fever. So it's interesting, they're all related, but Tylenol does not have the anti-inflammatory effect. And typically, Motrin is used anywhere from Motrin or ibuprofen is used in doses ranging from 200 milligrams to 800 milligrams. The biggest side effect from these are that it can burn your stomach. It can cause gastritis. It can even cause bleeding ulcers. There's a higher risk of that. Other risks that people don't recognize are it can interfere with your hearing. Not uncommon to have ringing in the ears, especially if you have someone who's got a lot of pain and is using high doses of Motrin on a regular basis. They start to have ringing in the ears, and the reason the ears are ringing is because the nerve in the ear is starting to be damaged by the Motrin. And I experienced this myself. I've got a couple of discs in my back that went south, and I was taking a lot of Motrin, and my wife put a disc in the disc player, and I said, "Oh, your disc player is terrible." And this is in her new car, and she said, "No, it isn't." I said, "No, that sound is awful. You need to take that in, get it fixed." She just looked at me like I was an idiot, which is not uncommon. But a week later, I was in her car again. It sounded great. And I was shocked. And I said, "So you took it in and got it fixed?" I got the same look. And then sometime after that, I put it together that it must have been the Motrin. And I did not have ringing in the ears, so I didn't expect it at all. And that's a problem. Aleve or naproxen can cause the same thing. And typically the doses, Aleve comes in 220 milligrams, naproxen comes in 500 milligrams. That's the prescription form. It's the same exact medication. And twice a day is all that's necessary with the naproxen or Aleve. So it's a big advantage. If you're managing chronic pain, you can take it morning and nighttime. But you have to watch out for getting too much and these side effects that I talked about. Other medications that can be really useful for pain, there's one that's called Neurontin. Generic name gabapentin. And this medication, for some people, works great. And typically for neuropathy, which involves damage to the nerves, neuropathy, sorry. Such as if you have a bulging disc, it's putting pressure on a nerve, and you get this neuropathy, the gabapentin can help to relieve that. Also, problems like diabetic neuropathy, where because of diabetes, it causes damage to the nerves. You can also get alcoholic neuropathy. Typically shows up as numbness or decreased sensation in the feet. Gabapentin can be very helpful for that. It's non-addicting, has very few side effects. About the only significant side effect is that it can make you sleepy. And a lot of people don't even get that. But if it does make you sleepy, then that's great. It's a non-addictive medication that could help you sleep, can to some extent reduce anxiety, and could also be helpful for pain. So you can kind of get 3 for 1 with a medication that is not very toxic at all. It's not metabolized in the liver. So there's a lot of benefits with this medication. For some people, it doesn't really work. It doesn't help with their pain. It doesn't make them sleepy. It doesn't help them to sleep. But in that case, then it's a cheap generic medication. They didn't waste too much money. But if it does work, it's a real benefit. And muscle relaxants in general, there are addictive muscle relaxants. I'm not going to mention them, but typically they'll have barbiturates in them, and they can be very addictive. There are several non-addictive muscle relaxants, like baclofen. Back is helpful here because it's often used for back spasms. That can be helpful for relieving the muscle spasms that pull the discs of the back together and cause them to grind on each other. If you just relax the muscles, it can take the pressure off the nerves. It's non-addictive, very few side effects. And there are a couple of others. Flexeril is also non-addictive, but it is sedating, whereas the baclofen usually is not. So in a patient who can't take opiates anymore because they've had a raging opiate addiction, you need to use everything you can to help that person to deal with the pain. Often just knowing that there are other alternatives out there can make a huge difference, because people really feel at the end of their rope and they're hurting and they see no way out except going back into their addiction. A lot of people with chronic pain will overuse alcohol, and it does work in the short term. But again, with the addiction and tolerance and dependency that we talked about before, you build up a tolerance. One of the side effects of alcohol withdrawal is increased muscle spasm. So you have more muscle tension, more pain. The problem that you were trying to get relief from in the first place gets worse. And that's the problem with every addictive substance, is you get short-term gain but long-term pain. Yeah, the flexeril, the sedation from flexeril, for some people it's debilitating and really could not work with it. But they could take it at bedtime, and that might be a reasonable alternative if it did help them to sleep better, etc. And it's similar to the old-style tricyclic antidepressants like Elavil, which are also sedating, and in some cases can be used also for pain control. But the baclofen usually is not going to cloud consciousness, and if it works for you, that could be really helpful. Now, there's some other non-medication things. A TENS unit stands for Transdermal Electronic Nerve Stimulator. And I think it works on the same principle that acupuncture works on. You're stimulating these nerve channels and kind of blocking the signal of the pain, allowing the back to relax a little bit, which then takes the pressure off the nerves and creates a nice cycle, or vicious cycle, non-vicious cycle, I guess, of relaxation, less pain, less tension, etc. And so a TENS unit has no side effects. It's not that expensive. It can be used without any other help. You just stick on electrodes on your back. And that's something that I think is underutilized. And I don't know what the cost of the unit is. I should know that. But I think it's probably in the range of $100 or $200. Originally, they were much more expensive. And things like acupuncture therapy, you know, it really does work. There's scientific evidence that proves that it works. I've had a lot of patients who've gotten relief from that. It's not, you know, the norm in Western medicine, but, you know, the side effects are none. And if that leads to relief, that can be a huge benefit. Learning how to relax. I guarantee you, most people, especially people in pain, don't really know how to relax. They do not know how to reduce tension. And a lot of addicts and alcoholics have never been relaxed. They've been loaded, but they've never, ever been relaxed. So learning how to meditate or other relaxation techniques, guided imagery or progressive muscle relaxation, can make a huge difference. It's like anything else that's good for you. You know, you have to work at it. It's like exercise. But there can be a huge benefit there from being able to relax and having that sense of control, that actual control over your tension and internal agitation. It does wonders for somebody's self-esteem if they can do that for themselves and don't have to get a pill to do it. Hot water in a jacuzzi can help with muscle relaxation. They sell these hot packs that, you know, that wrap around and create local heat for the low back. Those can be very useful. Ice packs also literally numb the pain and reduce the swelling. And these are all non-medication means of pain control that are actually much more effective. When you get to the point where opiates don't work anymore, they're less than zero in terms of their beneficial effect. They're making it worse. Every time you go around that vicious cycle, the pain gets worse. And anything you can do, regular Tylenol is overlooked by a lot of people, but it does have pain relief, very few side effects unless you overuse it. If you overuse it, you can cause liver damage. And ironically, the #1 medication used in America, Vicodin, causes a lot of liver damage because it has Tylenol in it. And drug addicts who overuse it can literally ruin their liver. There can also be other problems like hearing loss. Famous radio personality made himself deaf with his drug abuse problems. And but regular Tylenol in reasonable doses, you know, can be helpful. Physical exercise. When I talked to the back surgeon, and he told me, yes, I can do this back surgery, but you'll never be able to play tennis again. I said, well, that's why I want to get back surgery, so I can play tennis without pain. And he said, well, that's not going to happen. The only thing I could suggest is that you go to physical therapy. And so I did that and worked my way through it and avoided back surgery. So, but it's something that I have to keep up with on a day-to-day basis. And, but that's really a benefit. People really ignore that quite a bit. And you can hurt yourself if you're trying to exercise and you go too far. So it's a good idea to work with a trainer and to try to build up gradually. And low-stress things like yoga, Pilates are a good place to start if people are having a lot of pain and disability.